Welcome, welcome. Thanks for attending my live, guys. It is Sunday, and I have something very special planned today. So I'm looking forward to sharing all this information with you and the doctor as well. So let me just do a little welcome message in here. How's everybody doing? Hope everything is going well. Um, please leave questions. Alrighty. So we've been live for a minute, so I'm gonna go ahead and get started. So you guys, um, everybody has been asking me, and I've been getting a lot of feedback about healthcare in Panama. So instead of me guessing and just always giving you hi, welcome, Bliss Future Wrestlers. I'm not going to say your name correctly, but thank you. Hello, welcome from Maryland. Um, so I am here to share information about healthcare. Since I get so many questions, I felt like it's better to let the doctor come in and answer a lot of those questions. So welcome back to the channel. This is Michelle. Life Evolved with Michelle. I am a nurse, expat, and bodybuilder enthusiast, and I've moved from the US to Panama, and actually from the US to Panama City, and then from Panama City to Boquete, where I'm currently residing. Um, Even though he is my doctor. So today we are joined by a local doctor, Dr. Duncan, and we're having an honest conversation about healthcare in Panama, what to expect, what from medical, from a expat perspective. So as a nurse living here in Panama, Boquete, I also like to share my personal information about what I know, but it is much better. Jumped on here yet, so let me tell him we're waiting on him. Hi, Mr. Cordy from Alto. Dr. Duncan is a little bit behind. Um, you. So until then, until he jumps on, let me just tell you a little bit more about my experience here in tell you a little bit about Boquete, where I am, and the experience. I have not been to the doctor per se in Boquete, but I did learn that there are plenty of clinics around here where we are. I've been to several of them just by driving by them. I have not been into them. And the main hospital is in David. And David, from where I am, I'm in Alto Boquete. I am 35 to like 30, 35 minutes from Boquete. So if I'm sorry, from David. So if I had to go to the emergency room or hospital, that is exactly where I would go in David. So you can either do like ambulance or drive. A lot of people drive, take an Uber or whatever, because ambulance are hard to come by here. But that's what's going on in Boquete. Um, if you have questions, because he's going to be on here shortly, and I see him popping in now. If you have questions, hi, Wanda. You'll be here Saturday from Atlanta. Welcome. Are you going to Panama City or are you going to Boquete? Let me know in the chat. Um, I see he has jumped on, and so I'm going to bring him into the room and let him introduce himself. So here we are.
Yeah.
And hi, Dr. Duncan, and
Hello.
welcome to Life Evolve with Michelle. And thank you for tuning in. Um, I have a lot of questions that a lot of people ask me about questions, healthcare questions, and all that good stuff. So I'm glad you're here to give them the real lowdown, because there is a lot of misinformation out there. So I'm gonna give you the floor and let you introduce yourself and talk a little bit about your practice and what people can expect if they want to see a doctor in Panama.
Okay, Michelle, thank you very much. Sorry for the technical difficulties. Like
It's okay.
we
It's all good.
practiced, I practiced like 5 minutes before, everything was fine. And all of a sudden, like, yeah,
That's what
this is what
technology will
happens
do for you.
when you're
Yes.
live. Anyhow,
Yes.
my name
That's
is
exactly.
Dr. Ricardo Duncan, uh, founder and CEO of Smart Clinic and Lab. It's a clinic with the sole purpose of the just main focus on preventive medicine and functional medicine. The idea is we know the type of healthcare service that we've been getting lately. And it's not only failing in the States, Canada, it's worldwide. Seems like the focus have shifted from health and care into a business model. And most of us doctors are not even aware of what's going on. So for me, it was COVID. Like when COVID hit, um, it's like was like a veil was a, a drop from my eyes. So I saw the real business of medicine and what's going on. And we were taught that medicine was basically there to react. If you have an issue, oops, that's okay.
That's okay.
Like if you have an
Yeah, we
issue,
love this. We want to see your smiling face.
absolutely, absolutely. It's again,
There we go. There we go.
like if you have an healthcare issue, then you go in, you take care of the issue, and then it's reactive. Things
Yeah.
happen, you react, but actually, real medicine is preventive, being on top of things, making sure that you receive the proper health care, that you're maximizing your health, that you're investing in your health. And most of that is knowledge. So for us in Smart Clinic and Lab, the thing is knowing the part that you play in your health, like educating. I'm a doctor, an MD, board certified, and I know a lot, not flexing, I know a lot uh, in medicine, but I could never, ever dare to know as much as you know about yourself. So, real preventive medicine is working with my patient, receiving his or her information and applying it like, how can we work in tandem, like partners, to get you to the next level of health? So, this is what we do at Smart Clinic and Lab. Even though we know that medications and all that is absolutely necessary, but at the end of the day, there are chemicals that are not belonging in your body. And if we can take care of your body without or the least amount of medication possible, that will be the objective. Objective number one is to be as healthy as possible with the least amount of medication. And at the end of the day, that is your health, maximum health, less side effects. So that's what we do here at Smart Clinic and Lab. And just an overall of what's going on here in Panama. In Panama, we have the option of different type of healthcare services. An example of that is would be public versus private. In private, most of private services you can achieve with a insurance, which is not a requirement, not a must, like in the States. Like prices in the States makes it even prohibited if you don't have an insurance. Like here, for example, a normal doctor visit for a general practitioner could be around $20 to $50 out of pocket.
Mhm.
And a specialist, the most like it could hover around like 70 to 110, 120 for a specialist, meaning cardiologists, um, gynecologists,
Yeah.
gastro, neurosurgeon. So prices is way more forgiving than in the States. But the big difference is not even the professionals, because you see professionals that work in their private practices, working in the morning or doing shifts in the public, and then also working on the private sector. The big difference is the accessibility is overpopulated, is very, very crowded. What is the public service? So if you want immediate care, um, definitely based on the prices, I would suggest the public service. But the same, like I was saying, quality of the employees are there. It's not
Mhm.
like you're going to receive a better service because you are being on the private sector than on the public. It's basically the same.
You're
So
out again.
yeah,
Your camera went out.
so
Oh, you're
I have to
aware.
use this one.
That's all right.
Yeah, I'll have to use this one.
That's okay.
So yeah, those are the difference between one and the other type of services between public and private.
Okay.
Um, well, so I don't know if while I'm talking there are questions
Yeah.
as it produced.
So I will moderate the chat for you.
Hmm.
Right now, there is no questions in here,
Hmm.
but I do have a few questions if you're done, um, or you can continue if you like. But I do have a few questions to kind of get things.
Okay.
Okay.
Yes.
So you did touch bases a little bit on how the system works, like public versus private, and you gave a little bit of the cost, which is really interesting because in the U.S. it's very different.
Yeah.
It's it's different, but it's similar, right?
Okay.
We have to see a doctor like we do here. But in the US, it's not so much relied on you to take initiative. Like they do kind of do a lot for you. So like they'll call you for your breast exams, they'll call you for, keep calling you for your colonoscopy and stuff like that, which
Hmm.
is expensive, but they do that. Here, you kind of have to take your health care on yourself. Like
Hmm.
plan your colonoscopy. Make sure you're taking initiative for your own health care. That's how it is in Panama. But I did, and I don't know how you what you think, but I did. One of the biggest questions that people ask me that I get is, what happens if you have an emergency there? And like say, I don't know, you was walking and you twisted your ankle or something like that. What happens if you have an emergency? What do you do?
Okay. Great question. Because that's another thing that is similar but different.
Yes.
Is if you have an emergency here in Panama, you have the 911, same 911, but again, because of the overpopulation, like it's very crowded, you have
Yes.
to really have an emergency and express that so they
Yes.
can go in. Because if you fell and you bust your head and you're bleeding and someone is calling like, oh, it's bleeding and it's kind of falling asleep and we need someone here, like, well, can you get a ride to the hospital? And can you like, you have to be very specific for them
Mhm.
to go in. And even then it could take a while. A
Okay.
lot of people, what they do, because there are a lot of private ambulance services that people can pay like 25, 30, $50 a month to get, like, if you have an emergency, you call
Yeah.
your private ambulance service, they come in, you have paramedics, you have doctors that go in, evaluate and take you to the hospital, or can attend you inside if there's nothing major. So what,
Yeah.
that's one of the most popular options.
Mhm.
Some private insurance offers also ambulance services because of the same system. So that is, you have that option.
Okay. I do have another question, like the response times. Like say if you were saying that for ambulance, people arrange their transportation in advance. So like they'll like go with an
Yes.
ambulance service. So like
Mhm.
say you don't have that ambulance service, what do you do then?
So I think most popular, even though again, 911 you can call and they'll come and help you with the situation. It's kind of
Uh-huh.
dark.
That's
One of the services would be like, again, most people what they do,
mhm.
they get someone in the car and drive them to the hospital.
Yeah.
If you don't have that option, if you have the option, it is very it range from 5 minutes to 15, 20 minutes,
Right.
depending on time of the day,
Yes.
where you located. Because obviously in the city, if you're in the city, the response time is quicker. But again, depending on the time of the day, traffic varies a lot.
Mhm.
And that could vary between, like I said, like 5 to 20, 25, 30 minutes, the
Yeah,
response, or even
access is
more.
really important, and wait times, that's really important.
Yeah.
So
And,
thank you for that. Um, I do have a small question about costs
mhm.
on a typical, like if you're coming to you, say you're coming to visit you and you have no insurance, and um, let me get this question here. I got one question for you. Calling 911, don't you need to have a good knowledge of Spanish? This is at Ace's mom. She said
Mm.
hello. She knows you.
Hello.
Hello. She said calling 911, don't you need to have a good knowledge of Spanish? And what if you don't have an address? Do you drop your pin to someone, or how does that work? That's a great question. Like if
It's
you
super
don't,
important.
yeah, yeah.
Yes, and you can divide it into two. That question divides. There are two questions in one. Number one, the Spanish. Um, it would be great. It would be so beneficial to have a certain level of Spanish, which is, yeah, you want to have that.
Yes.
They are certain operators that they are bilingual, and you're praying to God that you get one of those, which
That's
you shouldn't. Like, the idea would be to have people that are bilingual and have a knowledge of medical, like,
yeah.
lingo in
Yes.
English. Because one thing is knowing basic English or Spanish, and then knowing the medical lingo. So there are certain phrases, or there are certain things that you can hear, and you can determine if it's an emergency or not. In
Right.
Spanish, the operators are trained, but then in English, it could be lost in translation.
Yes.
So yeah,
Yeah.
that is an issue. And yes, I would say, if I put a percentage of the operators that are knowledgeable in English, I would be lying, because I really don't know what is the percentage, but they are some that do. It's more common, again, with the private companies, and that's
Yes.
another difference. Another
Yes.
difference.
Yes.
If you go to a private institution, it's way more common to get an English speaking personnel from
Yes.
reception onward, that if you go to the public, sorry, to the
Yes.
public system. It is
Yes.
very, it, it's not common to
Right.
find a secretary or receptionist in the public system that understand clearly the English. They
Yes.
could be, but it's not common. That's why the private, they invest on those, because it's very important. Panama is becoming very international. It has been for years, but more so during the last 3 to 5 years.
And I
So
just on my experience, I've dealt with a friend of mine who had a situation in Panama,
mm,
and they had to have some medical care, and that Spanish, it really makes a
yeah,
difference in your care and just what you want, what you need, what you're feeling, pain, even understanding what the procedure is.
mm,
It can be a challenge, right? So Spanish is, like you said, very important. There are some Spanish speaking doctors, and there are some English speaking providers,
mhm,
just the same way as nurses or whatever. And she also asked, do you drop your pin for someone
yes,
to find you?
yeah, that would be the number one thing to do, because in Panama, like, addresses are not as common. Like
No
43rd Street
address.
East, and like, you are like, we are in front of the McDonald's that is in the corner of the park,
Yes.
and they're like,
Yes.
yeah, I know where you are. So it's like that. It's reference. Like, if
Yes.
you are in the building, I'm in the blue building besides the in front of the things
Hmm.
like that. But then
So,
there's where the pin comes, like,
yes.
crucial. So
So
yes.
let me explain what the pin is, because a lot of people probably don't know if they don't live in
Mhm.
Panama or uh, some of the southern parts of the world where they use that WhatsApp. So the pin is located on your WhatsApp. So basically, a
Mhm.
pin is dropping your location through your WhatsApp, and then they can find you that way. We
Yes.
have another question. Um, Dr. D, do you have a satellite office out here in Boquete? And if not, when? When will you have
Ah,
one? And that is from Ace's mom. And I'll tell you who Ace's mom is after we come off of live.
Okay.
But yeah, she asked you if you had
So
a
that's
satellite and if you
if not when,
when.
and that is a very good question
That is a
because that was on my after this first main office, like in Panama City.
mhm.
My eyesight was placed on Boquete because I
Okay.
know there's a lot of expats in Boquete,
Yes, there are.
and that type of service, like personalized preventive services, that it's not very common. Um, I want to offer that like in the entire country. I want to start in Panama, spread through Panama, and
Mhm.
then abroad. And Boquete is a strategic point. And I've been the last 2 months, I've been talking and analyzing things. So hopefully, it won't be long.
Okay.
Starting with at least like a couple days a month and a
Okay.
location, and
That would be
then having a
awesome.
location.
That will.
So just
And we
spread
have
the
one.
word.
Okay, go ahead. I'm sorry. I'm so sorry.
Yeah, I would say like spread the word, just spread the interest.
Yes.
So I'll
And
surprise you
that's
guys in
exactly what
Boquete.
I'm doing on this channel. I use Boquete as, with my life evolved. I try to introduce everybody to Boquete because it's a little bit different from Panama City, but they have a lot. So
Yeah.
my goal is to introduce people to this area, and so that but trying to show them like what's going on here. So we have another question from Wanda Health. And she asked, does one have to pre register with your office? And can you please repeat the name of your company, your office?
Okay.
Yes.
Company name is Smart Clinic and Lab. So and regarding like pre-registered, um, yeah, if you like, are you in Panama, you can come into our office or call in. We're going to put the number so you can call in and schedule an appointment. So what we normally do, like for healthcare, because I realized that medicine is individual. So you don't have like a one pill fix everything. Because we've been accustomed of be classified and put into this because you are of this age, sex, race. So based on this, your healthcare should look like this, like, and that doesn't work.
Mm-mm.
So it's I cannot treat you if I don't know you. So for those who has have appointments with me, they know that it takes at least the first one takes some time,
Yes.
at least half an hour,
Yes.
just to and we talk about everything because that is the base for medicine. I need to know you, and then we do a personalized lab based on what we think you should do. Yes, is the general, your A1C, your kidney, liver, your hemoglobin, things like that. But then based on what we talk, maybe we should do a hormonal panel or some specific vitamins or heavy metals, minerals, because there are so many labs that insurance companies won't dare to do because they're
Mhm.
so revealing. There are
Yes.
things, if you find out that you have certain things, you can fix it with lifestyle, which most of your issues are lifestyle fixed.
Yes.
And based on that, we can just improve our health. But we do that based on our conversation and on the lab results. Then we do a personalized plan
Yes.
for what you want and what you need. Some people just like, I need to lose weight or I need to like my skin or whatnot. And then, yes, but your hormones are a disaster. So let's treat this and then that thing will fix that. Or really, your liver is, if we fix this, if we do this, stress, there's so many things. So pre-register would be that first
Mhm.
appointment that we
Mhm.
do. And then based on that, we work on. So it's not like you have to we set an appointment and from there we work on that. And another thing very very important, I have patients that are not yet on Panama, they are still on the States, and we do telemedicine, like we do monthly appointments of Europe, in France, Canada, and the US. Now we
Right.
have we do telemedicine as well. Because
So
if
you
you're
have
going to
any
wait,
expats that still follow up with you, like if
yes,
they're
or
in.
people I haven't met yet, but we
Mhm.
are working towards. They want to come, or they they are not there yet,
Yeah,
but they want to start with their health. It's
yeah.
like, yeah, I'll be there in 3 years. So when I get in, I'll start with my health. Like you have to start, as
Now,
they say, the first time, like the best time to plant a tree is like 20 years ago. The
yeah.
second best time is today. So if you have the opportunity, start working on your health from today. You don't want to wait until, oh, if you have started it before, like, no. So,
This
yeah.
you have Miss Wanda Health. She said, "Thank you, Dr. Duncan. Sounds great. She'll be in touch." Ace's mom say yes to telemedicine, and she said we won't talk about hormones. That might give you an idea who she is. Um, Dr. Duncan, would you say you specialize in holistic health, general health, or neuropathic health?
Okay.
Which one?
For me is general health. And that is a misconception because general medicine is related to the normal medicine. But you come in, you're sick, take this, go your merry way. And general health should be what is your general state, which is the functional medicine. And then the holistic means the whole person.
Right.
Because if you come with a back pain, I'm not just going to treat your back pain. I'm going to ask you, like, what's your relationship with your boss? Like, you have a, like,
Hmm.
stress. Are you sleeping okay? How many hours you sleep? You drink enough water? Because it could be stress. It could be your kidneys. It could be just a muscle spasm. It could be so many things, and the treatment is completely different. And then that what I mean with holistic. If you have a heart condition, again, stress, sleeping, certain foods. So in that way, I would say functional medicine.
Got you.
Functional, meaning how the body works in tandem with real health is having a healthy mindset,
Mhm.
a healthy body, and a healthy environment. All that
I think you
influence your health.
frozen. I think he's frozen on us. Oh, there
Oh
you go.
no.
You froze up a little
Yeah,
bit for a second. You're back.
about that.
Yeah.
Yeah. So you got
Um.
that. That was a
So,
good one.
so general health for your dad with a general health with a addition to holistic. You do that as
Yes.
well. What is the biggest um chronic condition that you see coming to Panama from your expats? What is the heavy load for you? Like when people come in to see you for the first time, what have you noticed like a trend from expats coming from
Mhm.
US?
Okay. Physically, it would be like inflammation in general. I think inflammation is the biggest part, and inflammation could be causing that neuropathy, could be causing that stomach issue, could be causing that joint pain. So inflammation manifests in headaches, sleeping disorder, eating disorders, osteoarthritis. So I would say inflammation, obviously stress, heart condition,
Yes.
like high blood pressure, number one, and then diabetes, yes, or pre-diabetes, but I would say inflammation in general, stress, and heart condition. Like,
Heart condition. So it's not
yeah.
like because I was under the conception or misconception that it was like hypertension or diabetes, something, one of those chronic conditions that we normally have in the US that is highly diagnosed. And
Yes.
I know for me, when I first came to you, I was on a lot of medication.
Hmm.
I'm pretty healthy. I do work out a lot. You guys know that. But I was on a lot of blood pressure medicine. I was on some other stuff for anxiety, depression, whatever. And I went to Dr. Duncan and he evaluated my whole case. And he was like, you on way too much medicine. And so our goal was to reduce my medication down with my lifestyle. So for me, I was on 3 different blood pressure medicines and I am on 0 right now.
Good.
Blood pressure medicines. I'm not gonna say
Mhm.
that about
Eh,
everything, but the blood pressure medicine, we
mm.
worked to get that down, and he like brought me down. a little at a time, and now I take none.
And like I
So,
said, I'm sorry.
mhm, go ahead.
So like I said, inflammation, because high blood pressure, when I say like heart condition, like hypertension
Hmm.
is
I
one
think
of
your
those
light.
conditions. Yeah.
Hmm. I don't know why your light went down.
And the
Okay,
lighting hasn't changed, but it should be getting back.
go ahead. It's getting.
So
Hmm.
yeah. So high blood pressure, like in your case, stress stimulates the cortisol. Cortisol causes
Yes.
inflammation.
Oh my
Stress
God.
can cause high blood pressure. And then you're
Yes.
taking blood pressure medication and nothing is responding. And once you take care of the inflammation, the high blood pressure start going down. So it's like
Yeah.
a domino piece, a domino effect. And a lot of those conditions, like hypertension, which is number one, but then I see a lot of hypertension. And when we start taking care of the stress and the inflammation, all of a sudden the blood pressure start going down. So I'm like,
Right.
So it was what? The chicken or the egg? It was blood pressure that was causing inflammation, or inflammation that was causing blood
Oh,
pressure. So
yeah.
at the end, I've been seeing that reducing that stress that's causing inflammation reduces blood pressure, even sugar, and chronic illnesses like arthritis. As you reduce your weight, like it is lifestyle, like
It's lifestyle.
lifestyle.
Yes.
Once you
Uh,
realize, yes,
go ahead. I'm so sorry. I'm sorry.
what
Go
you're
ahead.
doing, like it is life changing, literally.
It is.
Yeah.
I agree. So I have a question from Blissful Resonance. I know I'm not saying it right, but what are your thoughts about the GLP-1 weight loss drugs, and are they available in Panama? And do you prescribe them?
Okay. Another great question. And the same thing, like a sword could be, let's say, an axe. We could chop some wood, do some fire, and save some life, or we could just destroy a village, depending on what you have in your hand. If you are if you are over the edge, if you are your condition is chronic and you are very very sick with your blood, with your cholesterol, with your sugar, your diabetes, you're obese to the point that at any time an emergency could occur. That is like a life jacket that you could use to put you to safety while you're working in your lifestyle changes. Because you could, at the end of the day, what is going to save you or make your life better is the choices that you're taking on your eating habits, on your stress, on your exercise plan. But during that time, you need something that would keep you just far from the edge.
Okay.
Hmm?
So is
So,
that
and
a yes to GLP-1s or
yes, when you do it correctly, because
okay?
I've used it with my patients, but before that, we do a full examination, especially of your liver, of
Hmm.
your kidney, and of your sugar, like your A1C. That's
Hmm.
very, very important. And then based on that, we use it moderately every 2 or 3 months. We check the numbers. And once we reach to a certain level where we feel comfortable, and during that time, we are working out, we are eating health, we're eating better, we're just changing our lifestyle. So that is what, in the long run, is gonna keep us healthy. Once we are at a good place, then we start reducing. We're reducing because we don't want to depend on that. So you
Right.
use it as necessary, and then we reduce it. So
So you don't use that for weight loss. You use it for disease management. You don't, or do
yes,
you use it for like say if someone comes to you and they're trying to lose weight, they don't necessarily have all of the chronic conditions, but
mhm.
they're obese, but they know, eventually they may lead to that. Is that something you'll consider or will you not do that for
Well,
just
yes, depending on your level of obesity,
weight? Hmm.
if it's gonna be if it's gonna put you in danger, I would consider using it. I would always do like if it's if you're not on that risk level, I would say like let's do something. Let's try this natural path because this is a long lasting results. This is going to be way better. Let's try this. And if it
Mhm.
doesn't work, we can use that as an aid. But
Gotcha.
if you are really obese and like at any moment, this obesity can cause, because some out of us think as obesity of something just that you can like, okay, I need to feel better because I don't like how I see. But that obesity could be causing issues with your knees, with your back spine,
Hmm.
with your back that would lead you to chronic pain and
Yes.
unnecessary pain. So if we can deal with that, doing using GLP-1s, then yes, we'll do it to make sure that you don't have to go through unnecessary pain. But if we can deal with obesity in a natural fashion, we'd rather use that than that. And if it's available in Panama at the moment, the one that's available is the Ozempic. So
Mhm.
that's the one that is available right now in Panama.
Okay. We have a question from Mr. Cordy. He's asking Dr. Duncan, please talk a little bit about men's health and wellness checks.
Okay. Um, Again, we have that advantage of having our hormones be with us for longer than our
Hmm.
female counterparts, and that helps us a lot. But men's health, we have our own specific issues. The number one differentiated issue would be the prostate,
Hmm.
and that is a very important thing. As now that we are in a age where everything is synthetic, ultra processed, lab produced, all those chemicals affects our prostate. So we have to be very careful on what we put into, how we exercise, the amount of water that we take, and our sexual health in general. And that
Hmm.
is very, very important. So yes, man health is yes, or sugar, again, kidney, liver in general, but then we focus on our PSA, our prostate, and testosterone. Because sometimes we think we are still as young and strong as in our
25.
20s and 30s, and then we're like, yeah, something is not it's not as as easy as before, and that is uh, or testosterone levels, and that is directly affected again by your level of stress
Yes.
or sleeping, how we sleep,
Yes.
and our nutrition. So
Yes.
yes, we are more geared. Nutrition is different because we are more focused on our male hormones to give us that extra, like protein absorption and things like that. So yes, is very important. And
Thank
normally we don't pay much attention because we are mature like doctors, like that. I got this.
Yeah,
Is
yeah,
no,
they
we
don't be
don't.
men don't like y'all don't
We
like to
don't.
go to the doctor.
Yeah.
Okay. I have another question. Are there any doctors in Boquete that you recommend? I think I asked you this already, but that you know of? Do you know any? I know you said not at the moment, but
Like specific, no. And yeah, I have to do a better job on that because if I need to know my future colleagues, so like
yeah,
not at the moment, but
we need to
oh, that's
just do
so
what we
important.
have to do, me
We'll
and
do what we
Ace's
have to
mom,
do.
to get you out here in Boquete because
I guess
she's
so.
gonna make it happen. But anyway, I just want to say, people that are chiming in the chat, thank you so much for your questions. I'm sorry if I'm not recognizing each and every one of you. You guys, this is like my third live, so I'm gonna be honest with you. I don't even know how to respond yet. I'm still learning YouTube and all the things that go with YouTube. So y'all forgive me, but I see all of you. I see C Bliss. Thank you so much. Anxiety Alley, Ace's mom, Ralph Cordy. Thank you guys so much for just chiming in and being here on the live. So, so the last one was been watching your channel. Ace's mom said, "Wow, not bragging on hormones, Dr. Duncan. You bragging on hormones because you know men hormones stay longer than women's."
I would
So,
just
um, so another question: can Americans use their health insurance here, or do they need something different? So if they have
well
health
at the
insurance,
moment I think there is one institution that takes some. I know there are a couple big institutions like the Panama Clinic, um, and maybe the John Hopkins affiliate, the Pacifica Salud, but they take
mhm,
like Medicare Advance.
okay,
But that last one is like an iffy. So I know Panama Clinic, and I think Oh, Minimed Hospital. You not
Okay.
only take that one, but take like a couple other different American insurances. And, but yeah, not very common. Yeah.
So just for the person who asked about the insurance, or I actually asked about the insurance, I'm sorry, the person. Just FYI, from my experience with insurance, coming to Panama, some places accept your insurance, some don't, but you actually really don't need it. You actually can afford to pay out of pocket for a lot of stuff. I'm not talking about emergency care or surgery and stuff like that, but I'm talking about like your basic
Hmm.
doctor visits, your basic specialty visits, labs, x-rays, all of that stuff is very, very affordable. And actually, your copay is probably more than your visit. And, in the US, when we have insurance, we have to pay when we go in, and then we get a bill, and we still
Hmm.
paying a lot of money for insurance. So here it's like a way out. You still need your emergency fund, and you still need maybe emergency insurance. But as far as like just doing your daily management of your chronic diseases, it's not really as necessary like it is in the US. And I mean, do you agree with that, Dr. Duggan, or um, am I saying something that's,
No, no, absolutely. Like for day to day stuff, definitely.
yeah,
Emergency or catastrophic situation, yes, you would like to have an insurance. And like I said, if you are there with Medicare Advance for emergencies, you are covered. But yes, if I would have or advocate for an insurance, would be for emergency situations. But for day to day, most
yes.
of the time, you can pay out of pocket, and it would be less than your copay.
Okay, I have one question for you, Dr. Duncan. There has been many posts on stem cell therapy, yet it seems expensive. Do you do something similar, or is that something that you'd recommend outside of your practice?
Well, something similar, but to understand that question would be to understand what does stem cell does. It would be instead of taking a medication for inflammation that goes into your body and take care of an area that is inflamed, what you're doing is putting in cells that are taking care of inflammation, or a knee that has been damaged and you need to replace those cells that was damaged. You put in stem cells, or you're putting in cells that are multiplying and doing and creating new connections that are fixing problems in a permanent way.
Okay.
Different from medication that you take, the medication wears off and you were right from when you started. Um, Similar, like we do not do at our practice. Similar, we have some IV therapies, homeopathic, that would, in certain conditions, like for detoxing or immune system or inflammation, that you go in and instead of putting in cells that would do the issue, would stimulate your cells that you have to fix or to reduce inflammation, to boost your immune system, to stimulate your liver and your lymphatic system, and to remove and detox your body. That would be
Yes.
similar, but they are then the level of stem cell. And I've been talking to certain stem cell clinics to learn more about their practice and how we could use that for preventive medicine and possibly to avoid surgeries. Because the idea is to, if you want to fix something, well, surgery would be like the ultimate fixer. But if you can avoid that and still fix the problem, that's where stem cells come in. So it's
That's
more than understanding
yeah.
what is the issue, because that is the key. What is the problem? And then once you know what is the problem, then the stem cell presents a viable solution. Because you can
Yes.
say, like, well, they suggested knee replacement because my knee is done. Can stem cell help? Well, when they say your knee is done, what is the issue? Oh, this is the issue. When if the issue is that there's no fix, so stem cell, what is going to do? So it's understanding what is the issue. So once you knew like this is what's damaged, does stem cell, how does stem cell will be able to fix or address this issue.
Yeah,
Not for everyone at every situation, but for there's a lot of situations when stem cells seems a good alternative.
that's very positive. Um, I know that there are a lot of veterans that come to Panama City. So how do you do you treat veterans, and then how do you, I mean, I know a lot of them have, like, there is a hospital in Panama that
Mhm.
sees veterans specifically. So how does that work if you have a veteran that comes and they want to see you, but they also have like the VA, and
Mhm.
VA is a little complex. I'm not a veteran. My husband and a couple of my close friends are. So I see some of the things that they go through. So what has your experience been with veterans?
Well, with veterans, I have a lot of VA patients. And yes, in Panama, they have like two or three hospitals that take care of a VA and they have their services and they don't have to pay. But still, because
Mhm.
of preventive medicine, because prevention is so important, they said, like, yes, we're going to treat our issues with the VA, but for preventive medicine, we're going to go to you and take care of this. Because if we can prevent getting certain complications and having to use the services, then
Mhm.
let's do that. Let's not wait so there's something damaged so they can know we can use the services that we are appointed. So
Okay.
I treat a lot of VA patients
Yeah.
on the preventive side, but when
Mhm.
they have things to do like their studies, their lab work, and they do that on the VA side, so they don't have
Okay.
to pay. And then they come with the results, and we discuss the results and see how we can improve
That's
on their
awesome.
health.
That's so awesome. Because a lot of times our veterans are not taken care of well. And you know
Yes.
that. So
Hmm.
we have a question. How long, if you have someone, you have you said you don't necessarily call it stem cell therapy, but like your IV inflammation
Hmm.
treatment, if someone is on something like that to reduce inflammation in their body, how long would they have to be on it to see a result? Like, do they
Well,
have to
again,
do it? Yeah.
well, that depends on inflammation, the level
Oh,
of
it depends on
inflammation,
the level of it.
and yeah, the level of inflammation, because it's not the same. Like I have just a shoulder issue because I was just golfing and I was, it's a chronic inflammation. Then when you have an issue that there's certain tear or tendonitis, like depending on what is the damage and your own body, how it heals, and your health in general. If you
Okay.
have other conditions like diabetes that
So it can take anywhere
slow,
from like 2 treatments to 20 treatments. There's not really a specific time frame, is what
yes,
I'm hearing.
yes, because
Okay.
if you're just sore, one or two treatment, that would be more than enough.
Okay.
Then a couple like 3 6 months of
Okay.
inflammation when you have something chronic. So yes, it again, medicine is individualized, and the key
Yes.
is finding out what's the issue. Once we can find out what's causing the main issue, then we can just prepare a roadmap and then travel it. And throughout that travel, then we can go making little tweaks and adjustment in the way as we see how the body is responding.
Yeah, I have a couple more questions, but I just want to let everyone in the chat know that I see a lot of messages here specifically for Dr. Duncan. He will be able to see those messages after the live, but
Hmm.
because of the way the live is going right now, he cannot see the messages. So I am asking the questions to him. And that's when, if you're wondering why he's not responding, is because he can't see the questions. C Bliss 1812 asks, Dr. Duncan, how is glaucoma treated in Panama? And are there alternative treatments other than the glaucoma eye drops?
Well, for that one, I'm not um, an expert in glaucoma, but what I've seen with my patients, yes, the ophthalmologist here, they have the latest treatment, and
Yes.
yes, you can treat it with the drops. At the end of the day, is controlling that pressure inside. And what I do in the practice, we have a great ophthalmologist, which we send, and depending on the issue, he can address and like address accordingly. What I've seen is there are like two or three different type of drops that you manage glaucoma, but
Mhm.
for curing the glaucoma, I cannot go into that
Into
detail.
that.
But like I said, we have one very good optometrist, which that is not with glaucoma, just the general like eye sights and all that, but with glaucoma and medical issues with the eyesight, yes, we refer to this Dr. Trapazza, very,
Okay.
very good ophthalmologist.
Thank you. That was awesome. Okay, so Sapadilla woman, welcome. What is the cost of stem cell therapy? Do you have any idea? I know you don't do it, but do you have any idea what it kind of runs?
Well, I was surprised of how expensive it was, but then when you consider versus a surgery and what you're getting, it depends. Like this place where I went to, they gave me a list of treatment, and this is the thing: there are treatment that could go up to 5 years, or it could
Mm,
be a couple months and up to 5 years, depending. I didn't know about that. I thought it was one or two sessions or a couple sessions, and yeah, no, he said it's a treatment.
mm.
So if I remember correctly, on the list there was I saw something like 2,300 to like 20,000, but I don't understand if it was
Wow.
for a period of time. And yes, I
Yes.
was like, oh
Wow.
wow. And then
Yeah.
he said, like, yeah, and there are people that pay that yearly for up to 5 years. I'm like, wow. Like if you have
Wow.
20,
That's a lot of money.
20
I
by
have,
five, that's a hundred
wow,
thousand.
that's a lot. I got a lot of, I'm gonna tell
Yeah,
you what these people are saying in the chat about that. It's a lot of money. But there's one
abs-
person I want you to answer real quick. Can we bring our blood work to you so you can explain it?
oh,
And if we wanted a natural approach based on the results.
absolutely. And that's one of the most common services when people come in. If they already have blood work, they come in, we analyze it, and then based on that, again, a roadmap. Based on what you have, where you are in life, this is the roadmap based on this. And then if we need to monitor or adjust, we every 3 6 months we can repeat certain things to see how we are, how our changes in life is affecting our numbers.
Awesome. So someone, Ace's mom said 10,000 K and up is what she saw for stem cell, and that's basic. And that was one treatment. Sapadilla woman said stem cell therapy treatment in Costa Rica was 9,000.
Yeah, because it's
So
basically around the same, like because of the, I guess, the technology or the way stem cell is, I don't know, is produced or what it takes to cultivate the cells and then all the procedure is that standardized. But I know that 10 years ago, it was way more expensive, way more
yeah, so it's
expensive.
coming down before
So,
they,
yes,
yeah.
yes. So
So there is a question
imagine.
here. Someone is joining late and they want to know exactly where your office is located so they can find you.
Okay, so the main office is located in Avenida Balboa in, in this PH Colores de Bellavista. That's in the city, right in the city. So, yes, we have a office in Toucan Country Club in the Wellness Center. But the main office where we are almost all the time is at Bellavista, right in the
Yeah.
heart of the city. And
So just to give y'all uh, a reference for Dr. Duncan, I was going to him from the time we moved to Panama City and until today. So like I don't have a doctor in Boquete. I'm going to Panama City to continue seeing Dr. Duncan because I feel comfortable with him and I know that I won't get unnecessary things done to me. You know how sometimes in the States they do all these different things unnecessarily. So living your life healthier and going to someone who is taking your whole health into consideration is top notch for me. Someone asked, how about arthritis? Do you treat that?
well, yeah, I'll try this again. Inflammation and all the things that are involved with that, depending on the level of arthritis and the level of damage, we
Mhm.
treat the inflammation. We treat what is a specific nutrition, a specific type of exercise, because exercise is very important in arthritis. But then,
Yes.
because of the arthritis, the pain doesn't allow you to do certain type of exercise. So yes,
Mhm.
we even find alternatives, but that is very, very common
Yeah. So
situation
let me
that we
ask you
find.
this question because this is so people who are in the States and they're on pain medication, like
Hmm.
prescription pain medication or anxiety medication, sleep, anything that alters your mentation, how
Hmm.
would they be able to? Because I know you can't get that over the counter, or can you?
Over the counter in here in Panama.
Yeah, because I know a lot of things you can buy over
Okay.
the counter.
Yes. There most pain medications you can. The sleeping medication and certain narcotics, you need a prescription. So for that, yes, you would come to the office, and after analyzing, we would prescribe the medication. And again, the idea is you're taking these medications, and we're going to provide it as long as you need it. But we are working towards removing the need of that medication. But
Yeah.
in the meantime, yes, you need it because it's never a good idea to cold turkey stop just taking medication. You have to be responsible in all type of medications.
Okay. So, Forster Robinson 3307, welcome. And the question is, what type of health documents or other things should XX gather before they leave their, or expats gather before they leave their home country and coming into Panama? So, is there certain documents that you think they should bring with them? Health documents.
Well, it's always good to have your last lab work, up your meds, the medication that you're taking, your pre-existing condition, things to let me know, like medically, where are you standing, who are you. But at the end of the day, if you come with nothing, this is what we're doing. We're analyzing, we're creating a baseline. Because if you
Hmm.
come with your prior history, that's good. So we can see where you are. But what's interesting to me, what I really want to know is where you are right now in your health journey. So we
Yeah,
determine like this is your starting point, and then we develop this roadmap. But if we can have a prior,
that would
it'd
be
be good,
awesome.
interesting just to for comparison measurement. Like look
Yeah.
where you were a year ago and look where you are now. So it's
Now,
important.
right. That's why I talk about on different subject, but I talk about that in my YouTube video, like starting a YouTube channel and how you can use that as a journal for yourself when you're looking at your life over a period of time. Like 2 years
Mhm.
ago, I was in a totally different place than I am now. But that's a whole nother story. Okay, so satellite office in Boquete is coming real soon. We're manifesting that. That's what we got in the
Yes,
chat. Uh, Great interview. Thanks for doing this. Thank you. I will be in Panama in July and will definitely be making an appointment with you, Dr. Duncan. That's Sapadilla Women.
perfect.
Is Rogaine sold in Panama?
Yes, yes,
Is it over the
Vanessa.
counter? It's over the counter, right?
No. Uh,
You got a prescription
um,
for
then
or
you
do
need a
you need a
prescription. I've done a couple of prescriptions for that. I'm not sure it's I have to check. I know it's available, but if it's over the
great
counter, I have to check
question?
on that.
Sapadilla, great question. You got them stumped a little bit. That's good.
Yes.
All right. Has there been any progress on medical cannabis allowed in Panama as of yet?
Well, as of yet, yes. Because
Okay.
I think I had an interview like a year ago, 6 months ago. Well, no, it was more than like almost a year ago, where we doctors had it had been approved, but then the providers, there was an issue with the providers. But happy to say that now, from mid February this year, we have a provider has been approved, and like CBD medications are available. Prescribe a couple of those,
Wow.
and that's a complete different conversation.
Oh yeah, we got to have another whole
Cannabis,
nother topic on that one. That's
yeah,
a
because
great.
cannabis done right versus narcotic medications, that is that's a topic on its own.
So
With
we're going to
so
do
yes,
that one as a
yes,
topic because that is an awesome. There are a lot of people that are using that to help them control pain and everything else. And
Mhm.
so that is a great topic. So, guys, one more question here, Dr. Duncan. Which hospital are you affiliated with in Panama?
Okay, here in Panama, different from the state that you have to be affiliated with a certain hospital. Once you are a MD board certified, the a patient could be at any hospital. As long as he is my patient, I can come in, identify myself, and I can go in
I don't know
and
if the
see the
connection
treatment,
has
advice.
kind of went down. Let's see. There you go. I think you're
Yeah. Can you hear me? Can
okay.
you see me?
Yeah, we got you. We got you.
Okay.
We got you.
Yeah. Once you're board certified, you can go into any hospital as long as you have a patient, identify yourself, and see your patients and
Okay. So there's not one
advice on the
specific
treatment.
hospital you
No,
can
no,
utilize.
mm-mm. No, you are
And it
freezing.
looks like, guys, that we're having, there he goes. We're having a little bit of slow connection here, right? It's going in and out. And I apologize for that. But he doesn't have a specific hospital that he affiliates with. So that's a good thing. Um, for arthritis, can duoxetine be purchased from the pharmacy when visiting Panama? Can
They
you, I
are,
don't, yeah, I see I'm
uh,
freezing as well. We're both freezing, guys.
yeah,
So we've been on for longer than an hour. So I'm not sure
I
if
think that
that's
is
why
it.
it's freezing. Yeah, it's freezing. And I apologize for the freezing, guys. But he doesn't, I don't know if I'm still frozen.
No,
Dr. Duncan, am I frozen?
now you are.
Okay.
There,
All
no,
right. Okay.
there you are.
So I apologize in it already, guys. You know I'm in Boquete, right? So I don't know what's going on with Dr. Duncan, but sometimes in Boquete we lose the connection. It's not often, but it does happen.
Hmm.
But someone says we're both good. So I think we covered most of the things that
Yeah.
I kind of wanted to cover. Is there anything you would like to tie up?
Just,
Any
I,
last?
well, I would like to say I thank you very much for the opportunity. And like I said, I know there's a lot of questions that were left on the table. So they're going to write you and we're going to sit down
Yeah,
and then try to answer the questions. And we're going to have like a another like a second part to this when you
yes,
come
we
in.
are
You'll be
definitely.
the guest in my podcast next time.
Okay, I'm excited about it.
I'm
I'm
going to talk
excited.
about that. And
Okay,
yes, the idea is to shed some light, and lifestyle and prevention is
yes,
a must and a privilege and something that you all should have access to. And that is the idea of what we're doing here. Just
yes,
shedding some light to the healthcare that you really deserve. Not the healthcare that you would desire, but which you deserve, which is real healthcare. So this is
yes,
what we're doing here. And hopefully, as long as God give me life and health, we're going to
that's it.
continue to shed
And we got you,
and
so
to
we're gonna
share.
be okay.
Absolutely.
Doctor, thank you so much for taking the time
No,
to come
thank
on
you.
and share your perspective. And now that I'm living in Boquete, but I still haven't lost my connection with Dr. Duncan. I will be continuing to see him. Like in a couple of weeks, I'm gonna be up in Panama City. You guys, Boquete is only six
Only
hour drive, only a 6 hour drive, or a
45 minutes.
minute,
Yeah,
right,
yeah.
45 minute flight. So it's very doable every 3 months or something like that. I hope you guys found this information useful and you've learned something from this chat, and that you'll tune in with us again for the next one, because he will come back. If you're watching this on a replay, please drop your questions in the chat so we can make sure we answer them. I will send him all of those questions and get them answered to you. Again, thank you so much for joining us. I appreciate the support. Um, I will be doing some things on my channel. I'm not going to talk about it right now because I'm trying to let Dr. Duncan go. But thank you again for tuning in, guys.
Thank
And I
you.
hope you guys enjoyed it and have a great rest of your day.
Enjoy. Thank you.
Thank
Mm.
you. All right. Bye bye.
No.